Good morning, everyone. It's me again, Mr. Ramsey, and welcome to the week 7 of our online class. So, the topic that we'll have today is about birth control. Okay, for our first word, birth control. So, please repeat after me. Birth control. Okay, let's spell the word birth control. Birth, B-I-R-T-H, birth, control, C-O-N-T-R-O-L, control, birth control. The next word is contraceptives. Again, contraceptives. Spell the word contraceptives. C-O-N-T-R-A-C-E-P-T-I-V-S. Contraceptives. The next word is vasectomy. Again, vasectomy. Spell the word vasectomy. V-A-S-E-C-T-O-M-Y. Vasectomy. Next word is spermicide. Again, spermicide. Spell the word spermicide. S-P-E-R-M-I-C-I-D-E. Spermicide. So in today's world of ever-increasing population, family planning is a necessity. So as we all know that their increasing population, or the number of persons or number of people here in this world is increasing or rising up. So family planning is very important. So necessity, it means important. Another word for necessity is important. So family planning, what is family planning? So it is the practice of controlling the number of children in a family. So when you say controlling the number of children in a family, before family have 11 or 12 children in a family, but right now they're trying to control it by using family planning, only 2, 3, or 1 child or children in a family, and the intervals between their births. So example, in 5 years, before they're having 5 children in 5 years, so that's every year they have a child, right? But using family planning, so they're controlling the number of children in the family by using that interval between their births. So example, in 5 years, if they plan to have uh, a child after 2 years or 3 years, so it means in 5 years they can only have 2 to 3 children. Okay, compared to like every year they have 5, they have a child, so that's 5. So that's what you call a family planning. So particularly by means of artificial contraception. When say artificial contraception, it is artificial, it means man-made contraception. So example of this are your condoms, okay, your IUDs, intrauterine device. There are a lot of artificial contraception that they give to the mother or the father of a child of a in a family, so that there's what you call family planning, or voluntary sterilization. So when you say voluntary sterilization, it means um, you can have tubal ligation, or cutting of the fallopian tube, or for the males, it's what you call your vasectomy. Okay. So various contraceptive methods have been developed, none of which is 100% successful at preventing pregnancy. So when you say contraceptive methods, contraceptive, contra, it means preventing. Okay, preventing, contra, it means preventing, and septive here comes from the word conception. Okay, when you say conception, it's having a baby, or um, baby, like pregnancy. So that's what you call conception, or having a child. Okay, so when you say contraceptive or contraception, it means preventing the mother to become pregnant. So these are the methods that prevent a mother to become pregnant. So it has been developed. So none of which is 100% successful. So these contraceptive methods, none of these are 100% successful in preventing pregnancy. They are only 99.8% effective. Okay. Here, 91% to 99.7% effective. That's the pills. We have here 91 to 99.7 again effective. Birth control patch. What else? Condom, 82% to 98% effective. 95% effective after 24 hours. What's this? Emergency contraceptive device or something like that. So there's still point something that is not it's not 100%. There's still 0.1 that a female become pregnant, so it's not 100% successful. So what you say contraceptive methods? A contraceptive method or device is a method or a device which a man or woman uses to prevent a woman from becoming pregnant. So some of the contraceptive methods or birth control methods, okay, are condom. This one is a female condom. Pill or contraceptive pill. Hormonal ring. IUD. It's not UID but IUD. Intrauterine device or uterine intra-device. Injection. Surgical sterilization. You say surgical sterilization, it means vasectomy, or another is tubal ligation. So vasectomy is for males and tubal ligation is for females. So when you say vasectomy, it's the cutting of the vas deferens of a male, and the tubal ligation is cutting of the fallopian tube of female. So the female will not get pregnant. So implant, we have here coitus interruptus. Okay, calendar rhythm method. So patch and the diaphragm. So a contraceptive is a method or device to prevent unwanted pregnancy. No sexual activity is the only complete effective method. So no sexual activity, it means no sexual intercourse or no sex. It is the only completely effective method. Or when you say no sexual activity, it is called abstinence. Well, abstinence in sex. So that's what you call no sexual activity. That's another word for no sexual activity. It means abstinence in sex. So sexual abstinence, abstinence. Okay. So it's 100% perfect method to prevent pregnancy. So no sex or abstinence in sex. So physical prevention is the most effective birth control, including vasectomy and tubal ligation. So according to your book, physical prevention is the most effective birth control, including vasectomy and tubal ligation. So vasectomy, it is cutting or tying the vas deferens of the males. This is the vas deferens. It is where the sperms are traveling, okay? And tubal ligation, it's cutting of the fallopian tube of the female. So it's either tied and cut, or it can be cauterized by using a laser, or banded, or it is tied. Okay, there's the three methods of tubal ligation. So in a vasectomy, vas deferens connecting the testis with the urethra is cut and sealed to prevent the transport of sperm. So when you say vasectomy, the vas deferens connecting the testis and the urethra is cut and sealed. So here's the testis, this one, and this one is the epididymis. So from the testis, it travels to the sperm will travel to the epididymis and then going to the vas deferens. So when the vas deferens is cut, so the sperm will not go to the urethra. So this is what you call your vasectomy, or cutting of the vas deferens of the males. So in tubal ligation, say tubal ligation, it means the cutting of the fallopian tube, okay, or the oviduct of a female. So in tubal ligation, the oviduct is cut. When you say oviduct, the another term for oviduct is what you call your fallopian tube. So it is cut and ends tied off to prevent the eggs from reaching the uterus. So from the ovary, so the egg will travel to your fallopian tube going to the uterus, right? But if this fallopian tube is cut, so the egg cannot travel going to the uterus. So there's no, and here the sperm cannot enter the uterus, and then the what they call the fallopian tube, because the fallopian tube is cut already, and the sperm and the egg cell will not meet. So how do we do that? So it is bonded, it is also cauterized, and it is tied and cut. So this is how tubal ligation is done. So oral contraceptives or your birth control pills, so it usually contain the combination of hormones that prevents the release of FSH and LH, stopping the development of the follicle, so no eggs are released. Because this FSH and LH are responsible to produce the egg cells. They are very responsible also for the development of the follicle, and that follicle will the one that release eggs. Okay, so the follicle is the one that is produced by the ovaries, and this follicle contains your egg cells. So if there is no production of or release of FSH and LH, there will be no development of follicle, so there's no egg that will be released. And this oral contraceptive birth control pills is taken every day. So you don't have the mother, the family, if they're using this one, they cannot they have to take it daily. But if they miss one, they can take two pills the next day. But if they miss 2 days already, and then so they have the tendency to become pregnant. Okay, so we have here barrier methods. Use physical contraceptives like condom and diaphragm, or chemical like your spermicides. Spermicides are the one that kills sperms, means to separate the sperm from the egg. So your male condoms, they are fitted over the erect penis, and the female condoms are placed in the vagina. So spermicidal jellies or foams, it kills sperms on contact and must be placed in the vagina before the intercourse. So about 1 in 6 couples is infertile due to physical conditions preventing the gamete production or fertilization. So out of 6 couples, there's 1 couple that is infertile. When say infertile, they cannot have a baby. So it is a physical condition that you will not have a baby. So it prevents the gamete production or fertilization. So what are the reasons why? So not ovulating, or there's no ovulation. Male infertility, so it means the male cannot produce the sperm that is desired to number of sperms or number of sperms that can travel. The sperms are not potent. Okay, age, like if you're already 50s or 60s or 40 plus. Okay, so that's an age factor. Lack fallopian tube, endometriosis, underlying medical problems. So what are the reasons of becoming infertile or being infertile? So number 1 here is blocked openings of the ovaries are the leading cause of infertility of females. So this is the number 1 problem why the females are infertile. It is because of the blocked opening of the ovaries. Next, for males, low sperm count, low rate of movement, or blocked ducts, okay, are common causes of the male infertility. So what are some treatment for infertility? So number 1 here is your hormone therapy that can cause egg production. Okay, they will try to inject something to the female so that there will be egg production. If the female is doesn't ovulate, okay, so they can inject FSH and LH. Another one is surgery that can open blocked ducts, okay. So those are some of the treatment for infertility. So what are the percentage of infertility in males and females? So 40% for the male due to problems, also 40% due to female problems, and 20% are caused by unknown conditions. So maybe stress, okay, maybe they have a lot of problems, maybe they are busy. So those are the unknown conditions. So next is in vitro fertilization. So we say in vitro fertilization, it's what you call your IVF. So these are what you call babies growing in the laboratory, or what you call your test tube babies. It doesn't necessarily mean that the babies are growing in the test tube, but they are fertilizing it there in the laboratory. So in vitro fertilization, or your IVF, these are what you call your test tube babies. It's a widely used technique to aid infertile couples. So I will discuss on how they do the in vitro fertilization later. So if the couple, like, they have problem of infertility, or they cannot have a baby, so they try to decide that they need IVF or in vitro fertilization. So they try to consult the doctor here, and then there will be normal hormonal stimulation. They will be injected with FSH and LH for the production of the eggs for the females and testosterone for the males. Then after that, they will have egg pick up. Okay, so they will get egg from the ovaries of the female. Then after that, they will going to fertilize the egg and the sperm in the laboratory. Okay, so and after that, they will have embryo culture. So they will culture the embryo. So when say embryo, that's the already the union of that's the fertilized egg. That's what you call your embryo. So it contains the male and the female, like sperm and egg cells combined already to get fertilized, and then it goes to embryo. So they do it in the laboratory. So next is embryo transfer. So after the embryo is cultured, they will put it back in the womb or the uterus of the mother, so that that baby will grow there in the uterus or the womb of the mother. And then after 9 months, so the baby, they can have a baby already. So I will further discuss this one. So how do we do this in vitro fertilization? How do they perform this? There's stimulation of ovaries by using injection of or taking medicine of FSH and LH that contains FSH and LH, so that there will be increased production of egg cells. And after that, there will be egg retrieval from the ovaries. Okay, and then they will get also sperm from the males. They're going to have fertilization of eggs. Okay, this one. So they will fertilize the egg by using the sperm of the male and the egg cell of the female. Then after that, embryo culture. So they will culture the embryo so that there will be life. Okay, that embryo. And then after that, there will be after this embryo is cultured and it's growing already, they will transfer the embryo to the mother's womb. Usually they transfer like 2 embryos, so that they will try to transfer 2 embryos there. So if one is not performing well, or if one is not good, another one is there's another one that can be grown there inside the womb or the uterus of the mother. Then after that, 14 days after, they will have pregnancy test to test if the woman is already pregnant. So IVF treatment process, step by step, guys. So step 1, stimulating the ovaries. So they will take FSH and LH so that there will be production of egg. Then after that, egg retrieval. So they will remove or get the egg from the ovaries. Okay. Then after that, semen analysis. So they will analyze the semen. If the semen is healthy, or the sperms in the semen is healthy, Then after that, they will fertilize the egg and the sperm. And after that, if there's already fertilization that will happen, they will grow the embryo there in the laboratory. Then after that, they will transfer the embryo to the womb or the uterus of the female for the embryo to implant. And then after that, after 14 days of embryo transfer, they will try to have the female undergo the pregnancy test so that they will know if the female is pregnant or not. So that's all for today. So please answer the quiz in the quiz assignment of your Google Classroom. And please try to, for those who didn't answer their PA, please, I will give you until tomorrow to answer your PA. So thank you everyone for listening and watching, and hope to see you soon. Take care of yourselves, have your mask on whenever you are outside, and bring your alcohol or your sanitizers. Bye everyone.